In today's episode, we sit down with Isabella, a registered dietitian specializing in oncology nutrition, to explore the powerful link between food and cancer prevention, treatment, and even recovery. Originally from Venezuela, Isabella shares her journey into clinical nutrition and the insights she's gained from working exclusively with cancer patients. We discuss common misconceptions, the role of diet in chronic illness, key nutrients for cancer prevention, and how tailored nutrition strategies support patients through treatment and into survivorship. Stay tuned. Isabella Ferrari is a registered dietitian who specializes in cancer nutrition. She's originally from Venezuela and moved to the United States to complete her master's in clinical nutrition. After working clinical and outpatient jobs, she now sees only oncology patients while managing the registered dietitians at Doherty Nutrition. Welcome, Isabella.
Thank you. Thank you so much for having me.
Such a pleasure to have you on. So, Isabella, I want to understand a little bit more about oncology nutrition. Can you tell us a little bit more about how you came to study and specialize in such a niche space within nutrition?
Yeah, so my first job was in a clinical setting. So I worked at the county hospital here in Dallas. And we had a cancer floor at the time, and it was also covering the outpatient oncology clinic here and there. And I realized that I loved working with cancer patients. I also personally, through my family, had a lot of experience with cancer as well. And I realized that it was a great place to be at and to help. And to be able to get your advanced practice in cancer, you need to see at least 2,000 cancer patients and then take boards or take an exam that we need to take every five years just to make sure that we're, keeping up with all the new information out there. So I started doing that in about 2021 while I was still working in the clinical setting. And then I just started doing that in the outpatient setting as well. So it's a combination of what I liked to do in my day to day, and then also personally, I just really like working with patients with cancer.
So it's a very specific field, and I assume the nutritional needs also are very, very different. How do you help others really understand this connection between food and health and really help them bridge that gap?
Yeah, I think working with patients with cancer is actually a lot easier for them to understand that. If you compare it with someone that's trying to lose weight or do something more long term, I think cancer patients have a very kind of sudden awakening of oh, what I do in my life can affect certain things. So they usually come really ready of okay, tell me how or what can I do with food? So it's important also to not make them feel bad about any choices that they might have done in the past, because we can't really say, oh, because you did this, this is the reason you have, you're going through what you're going through right now. So they usually come ready to learn and ready to listen and ready to do whatever they can. What I always say is food is kind of really the only thing that a patient with cancer can control, because the doctors are telling them when to go in, what labs to take, what chemo to take, how often. So they're controlling their whole health for them, which is what they should do. I'm not saying that they should not be, doing that, but the patient is left with, what can I control? What can I do? And usually food is one of the things that they can. So it's, they usually come super eager to learn.
I imagine the question I'm going to ask you next is probably not a blanket answer, but may also differ for the types of cancer as well. But how do dietary habits influence any kind of progression of cancer?
Yeah, so there's not really any research that says if you eat this and this, then your cancer is not going to grow, or if you eat this and this, your cancer is going to grow. The main thing we try to focus, especially during cancer treatment, while someone is going through chemo or surgeries or immunotherapy, we try to make sure that during that time, they are getting the food and the nutrients that they need so that they're able to go through that period of time without having too much weight loss or a lot of side effects that, sacrifice quality of life. So I think it's also very individualized. For example, if someone has, head and neck cancer, they're going to have a lot more issues eating and a lot more issues like swallowing. So we need to be a lot more specific with that. If someone is going through breast cancer, they're probably not going to have a lot of issues with swallowing, and a lot of the chemos. Some of the chemos might not be as aggressive as others. So we can try to focus on more healthy eating. And then for other people, it's more like, you got to eat what you can. And these are recipes and tips of like how you can do that. So it really depends on the cancer. And there's not a specific food that can progress or make cancer worse or better. There's general eating patterns. So, always a more plant-based, fiber-rich diet is what's going to help in the long-term survival in general, not only for cancer patients, but also with people that are trying to avoid cancer. That would be what we would recommend in general once someone is out of the treatment phase.
Which takes me to what I nuanced in the previous question, which is, as you're thinking about certain types of cancer, you mentioned someone who's having trouble swallowing, depends on the different types of cancer. What are some of those modifications that you recommend or that you suggest across different types of cancer?
Yeah. So, for example, someone that has issues swallowing food, the first thing is they have to go see a speech therapist, and they're the ones that are gonna know more about the texture of the food that's safest for them to eat. And once we know what the texture is, then we can make sure that whatever they're eating is calorie and protein dense. So we can make sure we give them recipes on how to do this. So it would be, in that case, people that have issues swallowing, that would be the case. There's a lot of people that have nausea, bloating, low appetite, fatigue. So then we can help them as well. It's like, okay, if your appetite's low, let's, for example, try to eat something small every 2 hours instead of trying to think breakfast, lunch, and dinner. Everything you eat has to be nutrient and calorie dense. So, for example, a lot of people love like, I'm going to have some chicken broth or I'm going to have some Jell-O. That's great. And I love that, people are craving things, but that's really not going to nourish us as much. It's just going to create space in our stomach that's not providing us with a lot of nutrients. So a lot of my job is trying to make whatever they're eating or whatever they're craving more nutrient dense.
And what are some ways that you're able to make it more nutrient dense?
Yeah, so I'll give you an example, oatmeal, right? People usually eat their oatmeal, put it in water, and maybe they add a little bit of sugar or a little bit of butter, depending on that. So I'm like, okay, let's grab your oatmeal that you do in the mornings, and let's add some high protein yogurt, right? So let's find a yogurt on the shelf that is 20 grams of protein, or let's add some milk, some whole milk. Totally fine to add. Again, you're getting more nutrients with that. Let's also add some chia seeds. Let's add some peanut butter. Let's also add some fruit to it. So we're adding protein, we're adding fiber, we're adding healthy fats with the same meal that someone does already. Or, for example, if someone's drinking like a protein shake, one of those pre-made liquid ones, I always say pimp your shake, kind of like pimp my car show, but pimp your shake. So I'm like, okay, we already have your shake. We know you like it. Let's add a tablespoon of peanut butter. Let's add some maybe milk to that, and let's blend it, and let's maybe freeze it so that it tastes more like a ice cream and you want it more. So whatever people are eating and craving, how can we make that more nutrient dense? I also don't like giving them like a complete new thing that they've never done but before, because they're probably used and they find comfort in what they're doing already. So I just try to make that better. Of course, if they're open to trying different snacks or meals, I'll give them options for that as well.
I love that in your approach, you're really incorporating the needs and preferences of the individual and the types of foods that they're used to eating according to their taste palette. When we talk about foods and that relationship with something like cancer, I would be remiss not to mention, something around cancer prevention. So I know this can also be an interesting question, but do you recommend any key foods, nutrients that play a large role in cancer prevention as well?
Yeah. So the main foods that for now show, and it's important to notice a couple of things there. So the diet for cancer prevention is actually the same kind of diet for cancer survivorship. So someone that already went through cancer and is trying to make sure they don't get cancer again, this diet that they're going to be eating is the same one for someone that has never had cancer. Um, you know, so what we recommend is a fiber-rich diet. That is the main nutrient. Nutrient depends on who you talk to if it's considered a nutrient or not. And then high in phytochemicals and oxidants. And that's basically fruits and vegetables because they're the ones that give us a lot of vitamins. And then fiber can help just our GI system in general. Protein also plays a huge role. I believe that the role that protein plays is more related to how it can help muscle and muscle growth, and how having enough muscle can help just in the long run for anyone trying to be healthy. But I would say, I would focus a lot more on fiber. We should be getting about 25 to 30 grams of fiber a day. And it's, I think the latest study showed that the average American eats about 11 to 14 grams of fiber a day. So we have a lot of work to do on that. The good thing is that it's really not hard to include extra fiber. Like if we know what someone is eating on a day-to-day basis, it's easy for us to be like, okay, let's add a snack, or let's two snacks that each have eight grams of fiber, right? And then boom, you can go from 14 to 30.
So what I'm also hearing you say is that there are quick and easy wins here. You just have to know, and you just really have to understand your food better in order to increase some of that fiber in this example.
Yeah. And if I can add something to that, a lot of people think that they need to like revamp completely and try this super new trend that someone said, or go completely keto, or go completely plant-based, or like do all these different things. And it's really like, you can do really small changes that have a huge impact as well. And it's also important to always look back at the basics, right? Are you sleeping okay? Are you drinking enough water? Are your stress levels contained and, and good? If those things, or are you sleeping okay? If those things are not the basis and are not being taken care of, food can't fix all of that. So it's not only food, it's like lifestyle as a whole. Because you can be eating the most plant-based diet that you want, but if you're stressed all the time, you don't sleep properly, you get 3 hours of sleep at night, you don't have like a community around you, that's also super important. You're really not helping your cancer risk as much. So I like to think about it as a whole.
I'm finding with everything you're mentioning, I'm finding a lot of overlap with like what we do in diabetes prevention, or even in cardiovascular risk. With everything that you're mentioning, for instance, the fiber-rich foods, or looking at overall lifestyle like stress and sleep and all those things, I'm seeing a lot of intersection points there between like general chronic conditions and even something like cancer in particular.
Yeah, for sure. And one thing that I want to mention too is that because it's not only food, and there's also like exercise and sleep, cancer specifically, and really any other chronic disease, but because I work in cancer, I'm going to try to talk about that. It has to be a multidisciplinary approach. So I am very, very conscious about this. And if a patient comes and they're like, yeah, I just find you on Google, I'm like, did your doctor say you needed a dietitian? They're like, no. I'm like, okay, well, give me your doctor's number, because I'm going to talk to them, because they should be referring everyone that has cancer to someone that's going to help them with food. The same way that I always tell them, are you seeing a physical therapist? And are you seeing a mental health professional? Most of the time, the answer is no. And I'm like, here's a number for one, here's a number for the other one. So we should be approaching movement, mental health, and food the same way that we're like, here's your chemo drug, right? Like there's a lot more that goes into it than just your chemo treatment.
And sometimes the conversation just stops at the chemo or just at the nutrition. And what you're saying is like all of these other facets have a huge role to play in that disease progression as well.
100%.
How does having a healthy diet affect symptom management and even weight loss that are common in patients with cancer?
Yeah, so I wouldn't necessarily really call it like a healthy diet can help. I think like a personalized diet is what I would call it really, because sometimes I say like, okay, add whole milk and then add ice cream and then add. So it's not necessarily considered healthy, right? But for that patient, that is what they need during that time. And I think symptom management is what I do most of the time, because that is what affects like quality of life really, and really affects the fact, for example, if someone's like extremely weak and they've been losing weight, they might delay chemo treatments. And that's the main thing that we want to avoid. So it's mostly like, okay, are you keeping your weight? Are you keeping your food down, which kind of correlates to the weight as well? And are you staying physically active? I'm not saying that people have to run marathons or like lift super heavy, but are you walking? Are you going to your physical therapist to kind of see what we were talking about? So it depends on the symptoms. So if someone has a lot of nausea, then, a lot of things that I recommend that people don't think about that much. It's like, okay, stay away from the kitchen. Like if you have someone that cooks for you, have them cook, you be outside. Don't try to smell anything and then eat outside or eat with the fan on where you don't have to smell those things that can make you nauseous. The other things, like try to eat your food on the colder side so that you don't smell those things when the food is warm. That can help a lot. Ginger candies and adding ginger to your foods can help. Peppermint tea with even some ginger can also help with that. Also not drinking your liquids with your meals, having your liquids just be kind of like in between the meals can be super helpful. Again, you don't want to have your stomach full of liquid and food that can make you more queasy, right? If you think about it. So those are certain things that we try. If someone is, feeling full very quick, which can happen, then I can talk to them about like, okay, let's go on a 10-minute walk around the house midway through your meal, right? That can help you kind of like move your food down a bit. So that's helpful. It can also be like, okay, stop thinking about, like I said before, like breakfast, lunch, and dinner. Your new meals are meal 1, 2, 3, 4, 5, and 6. And they are served in a 6-inch plate, and you can eat whatever you want from that plate, right? So it just, and it depends also on how much help the patient has with food. The great thing that people don't really think about, and I think a lot of cancer patients do not like asking for help or like receiving help because they feel like, I don't want people to see me a certain way, right? But if you put yourself in your friend's shoes, the only thing they can do, like they want to help as much, right? So I always tell them like, accept help. And if someone says, how can I help you? Tell them, can you make me food, please? And people are going to be the happiest that they can help you and provide you with something that's helpful. So I think having people cook food for you, that you don't have to expend the energy mentally or thinking, what am I going to eat, or physically trying to cook things, I think that's super helpful as well. So I try to go through all this like diet history with my patients and try to see where they're at and where like tidbits of things that I can add that can make their life easier. And at the end of the day, again, my goal is for them to not lose weight so that they don't need to delay treatment. That is like what I'm always thinking about.
And that's one of the pivotal things, because if the diet is not aligned, or if it's not, helping the person like gain weight or, be healthy enough for chemo, that has an effect as well, because then it's delayed chemo, which has its own, which, of course, has its own impact itself. During cancer treatment, what nutrition strategies are used to address different stages of cancer?
Yeah, I don't think it's necessarily dependent on the stage of cancer. It depends more on like what treatment they're getting, right? If someone is getting, for example, like radiation, radiation really does not have a lot of nutritional implications. For example, if someone's getting like radiation because of their breast cancer, that's really not going to have a lot of nutritional things that we can do. So that can see like that's a great time to like, okay, because you don't have nausea, vomiting, your weight is fine. Let's start talking about how we're going to eat after we're done with this. So let's talk about how can you incorporate more fiber and fruits and vegetables and movement as well. So it's not necessarily related to the stage of cancer, because people can also be stage 1 and have really bad side effects from the chemo, or I have some people that are stage 4 but are super stable, and they don't need a lot of help. I think the other thing that we play a huge role in doing, there's a lot of drugs that patients can be put on that affects their blood sugar. So steroids, and there's a lot of other ones that can affect your blood sugar in general. So we help a lot with making sure your blood sugar does not go over the roof, and not have those like chronic effects of having a high blood sugar.
There's so many different things to take into account is what I'm learning here.
Yeah.
What kind of long-term nutrition plan is recommended for cancer survivorship? I know you mentioned that it's a lot of intersections with even cancer prevention, but just broadly, as we're talking about cancer survivorship, what would you recommend?
Yeah, I think in general, keeping a healthy weight is a huge one. So, for example, if someone comes into cancer and they're overweight or didn't have a super healthy lifestyle before coming into cancer, and now they're coming out, it's totally okay to lose weight after treatment, and actually probably encouraged. I like to see it more, again, as a lifestyle thing of like, okay, your lifestyle before wasn't great. Let's change your lifestyle here. And I always say weight is a consequence. So if the reason for someone being overweight is their lifestyle, then they're going to lose weight if we change that lifestyle, right? I always tell people that come in for weight loss in general, like cancer or not cancer, they're like, I want to lose 20 pounds in a month. And my answer, which can be annoying sometimes, I'm like, oh, cool, drink celery juice for a month and you're going to lose weight. Like, right? If that's your goal, we can do. But people really, that's not their goal, right? If you talk to them further, their goal is, I want to be healthier. I want to live longer. So we try to change the tone into like, it's not weight loss, is the lifestyle and the weight loss that comes as a consequence of that. So it's definitely a conversation that can happen after cancer. A lot of that weight loss, I also wanted to come from muscle building. So the more muscle that we have, the easier it is for us to lose weight and the stronger our bones are. That's another huge thing, especially with breast cancer. If someone's put in like letrozole or those meds that go, after cancer, those have a huge effect on our bones. So super important for them to do strength training and eat enough to make sure that that bone disease, that bone issue kind of doesn't continue. So again, very individualized, but I would for sure recommend healthy weight loss through lifestyle changes to someone that went into chemo being overweight. And then I would also recommend, again, including extra fiber, strength training, and it depends on their long-term goals too. I love that some people are like, I just want to be able to play with my grandkids when I'm older. So I'm like, great, let's call the physical therapist, make sure that you're able to do all the things that you want to do. And my role is to make sure you eat enough protein to support that muscle, and eat enough fruits and vegetables as well to make sure your body is not in an in inflammation state, to try to get you to that place. So I really like to work with them and what their goals are. But I would say weight loss is totally okay. Extra fiber, extra protein, and movement for sure.
Lovely. With that, Isabella, we are toward the end of the episode. Can you tell us how can our listeners connect with you and then just learn more about your work?
Yeah, so you can Google or go through our website, DohertyNutrition.com. You can book through there. You can also call our office. For me specifically, because I only see cancer patients, I would ask for me. If you want to be seen by me, there's also other dietitians in the practice that can see cancer patients. And then if someone's interested in general health and wellness, or like I would say, we all eat, so we all have issues with eating, and we have someone that can help, and also match what you are looking for. So in all socials and our website is just Doherty Nutrition.
Lovely. And we'll link that up in the show notes below. With that, Isabella, thank you so much for your time. To our listeners, thank you for joining us for another episode of the Yumlish podcast. Head over to our social media at Yumlish, either on Facebook or Instagram, and find this podcast post and comment below to tell us, how have good habits helped you sustain a healthier lifestyle? So just general healthier lifestyle habits is what we're looking for. So we'll continue the conversation there. Again, Isabella, thank you so much and appreciate your time here.
Thanks for having me.